to our medical terminology Unit 5 section. We're going to be talking about directional terms. So these are some very particular terms that you're going to see in relation to the body. There is a Unit 5 word list, so go ahead and please bring that up. Make sure you have that in front of you to reference as we're going through this section. Okay, let's take a look at the objectives. So we're going to start to divide the abdomen. We're going to look at the different organs that are found in either a quadrant or a region and what that means, abbreviations related to the abdomen, and we're going to do some recall from a previous unit where we named some of the organs themselves. So if you need to go ahead and reference those videos, please do, and then this one should help with some of the answers here. We're going to talk about regions of the spinal cord, planes of the body, and then we'll get into the actual directional terms, but I think once you understand those first few pieces, the directional terms will all fall into place. And then we're going to put together medical terms, break them down, related to these directional terms and how we use them inside the body. So let's first take a look at how we divide and organize the abdomen. So I've got two pictures here. And let's first take a look at this left side of this picture. And what you really see is kind of the human body. I have sort of shaded out some of the organs. This is not really an organ-specific discussion, but the organs are inside of the abdomen and inside of the pelvis. As we are looking at those, I placed a little blue plus over the top. And so this really divides the abdomen into 4 sections. And if you remember from our prefix unit, and again, you can go back and reference that through our videos, the prefix quad, Q-U-A-D, refers to 4. So when you see our abdomen divided like it is in this left-hand picture, that is what we call an abdominal quadrant. Okay, quad meaning into 4 sections. On this right-hand picture, you see the same abdomen. And what's going to happen is that we've now got what I always like to refer to with my students is the tic-tac-toe board. So if you've ever drawn tic-tac-toe, and most of you have, it looks exactly like the tic-tac-toe board has been drawn over the top of the abdomen. And this really leaves 9 sections that the abdomen, the pelvis, right, have been subdivided into. And so this is what we call abdominal regions. Okay, so why the difference between quadrants and regions? And that's really specific to every individual practitioner. Quadrants are extremely easy. You're going to see that they're super simple to name, to use abbreviations for. However, abdominal regions takes it from 4 to 9, which is a little bit more specific when we're trying to really locate what is wrong with our patient. And if we want to be extremely specific, we're going to go with the abdominal region names versus the abdominal quadrants. However, you're going to see both in all of your licensure exams, your certification exams, your SOAP notes, your practice notes, and your orders. So making sure that you can use this terminology in both formats is very, very important. Okay, we're going to start with the quadrant portion. And again, remember that quad meant 4. And so you're looking at this picture here on the left, and it literally just looks like a little plus sign, and it divides the abdomen into 4 fairly even sections. Okay, this is the right side and this is the left side. So before we even name the quadrants, what I'd like to do is discuss why this right and this left don't look like the traditional right and left. Okay, the right looks like it's on our left-hand side and the left looks like it's on our right-hand side. So why is that? Because every diagram we look at from here to the end, whether you're in anatomy, physiology courses, medical terminology courses, any of the textbooks for medical is going to show our diagrams like this, where the right is really on the left side of the page and the left is on the right side. And when we label things as a right or a left, we are talking about the patient's right and left. Because our diagrams, we are always looking directly at a patient, that right on the screen, it is our left, but it is the patient's right-hand side. And that left that you see on our screen is really the patient's left, not really our left from our vision. So you almost have to start to learn to do things backwards because you need to label a patient's right and a patient's left. And this really took me a long time, right? The first few classes where I did this was so difficult. And I'm sure I missed many test questions because of this. However, over time, you start to recognize that we're always labeling patient right versus patient left. And diagrams as a standard, we are looking almost face to face with a patient. And so they are opposite on all anatomy pictures. That is fairly standard, right, for all anatomy photos, whether they are in anatomy textbooks, med terminology textbooks, or anything else. Okay, the rest of the quadrants are relatively simple. So here we have the right upper quadrant, right, because it is on the right-hand side. It is on the top half, and it's part of the quadrants, or the division of 4. This side is the left side, so that is the left upper quadrant. We then have the right lower quadrant, right, because it's below, okay, that upper portion. And this is the left lower quadrant. So in terms of being able to name these 4, that is generally a fairly simple task if you can make sure that your rights and your lefts are on the right-hand side. So as you head into your tests, just make sure you've got your right and lefts situated. And then we've just got uppers versus lowers. Okay, fairly simple. Okay, so let's take a look at some of our first abbreviations here. So first, that right upper quadrant is abbreviated RUQ, which is just the first letter of each of the 3 words capitalized. Okay, next, the left upper quadrant is abbreviated the LUQ. The right lower quadrant should be obvious, the RLQ. And the left lower quadrant will be the LLQ. So whether you use the full term or you use the 3-letter abbreviation, okay, just make sure your right and your lefts are situated, and then it's fairly straightforward from there. Okay, next we have our abdominal regions. So the regions, again, I mentioned it was more like a tic-tac-toe board. It is a section of 9. So we're going to see something very, very similar to what we saw with the last one, although these have a little bit more complication in their naming. So here's a look at the abdominal regions. And again, just remember that the right is the patient right, the left is the patient left before we start labeling these sections. Okay, so on the right, we always start with the term right. And then this top section here on the right is referred to as the right hypochondriac region. The good news is on the left-hand side in that very top region, this is just the left hypochondriac region. Next up, we have the right lumbar or the right lateral region. So really just depending on what text you are using or what picture, both are perfectly acceptable inside of medical education. So you may see it as the right lumbar, you might see it as the right lateral. They refer to that same section. The good news on this side is that this is just the left lumbar or the left lateral region. Okay, moving down, this is still the right side that just popped up. This has also got 2 potential terms that are associated with it. So sometimes it is referred to as the right iliac region, which refers to your big hip bone. So put your hand on your hips. Okay, that is the iliac bone. It is often referred to in some diagrams as the right inguinal region. I know that's kind of a tough one to say, inguinal, but that refers to the groin. Either are acceptable, and you will see both in various texts. And then down the left-hand side, we've got that left iliac, or that left inguinal region. Let's come down the center section of 3 now. So this top portion right down the center has a unique name. So you're no longer seeing a match with the right to the left, with the only difference being the words right or left. But this one in the top center portion is referred to as the epigastric region. Moving down right into the dead center of the tic-tac-toe, this is the umbilical region. Umbilical. And this very bottom portion is the hypogastric region. So in that center, that top portion is called epigastric, and the bottom is called hypogastric. So different prefix, same root terms. Now let's take a look at each of the subdivisions and what organs are in each of them. This is where that right and that left, while they might both be the hypochondriac region, are going to have some slightly different organs. If you don't remember the names of the organ, go back to our video where we labeled up the organs. We gave a really solid picture and where they are located in that abdomen. This is going to really pertain to the regions and what's found within each region. So in the right hypochondriac region, we see the liver. We're going to see the gallbladder as it's tucked right behind it, and then the large and the small intestines. On the right-hand side, so this is that right lumbar or that right lateral region. So we do see that tail end of that gallbladder. So we did see it in that section above. It does cross into two regions. We see a lot of large intestine. We're going to see one of the kidneys, the right kidney. And then moving down to that last right section, the right iliac or the inguinal region, we're going to see the appendix. And this is kind of a unique organ, and a lot of people understand appendicitis is when that appendix becomes infected. It starts to swell up, become infected, and needs to be removed. And one of the biggest signs is having pain in that right lower side. And so if a patient comes in and says, hey, I'm having pain in that my right side all the way down, like almost into the pelvis, right, that may be a sign of an appendix issue. There is some large intestine there, so there could be some other issues that are going on. And there is an ovary there if you've got a female patient. And so those might be the other things that you are looking for if a patient has pain in that area. All right, let's head down the left-hand side. So that left hypochondriac region contains the spleen, the pancreas, and part of the large intestine. All right, continuing down that left side, so that left lumbar or that left lateral region. Again, you're going to see that large intestine, so it actually goes through most of our regions, as you've noticed so far. There is the left kidney. And then down to our left iliac or that left inguinal region, we're going to again see that large intestine and another ovary. But as we only have one appendix and that was on the right-hand side, right, if they had left pain in that lower region of their abdomen, we're really only looking at a couple of options over there, and it most likely is not an appendix issue. Let's take a look at that epigastric region. So we do see the stomach, part of the liver, part of the pancreas, as well as the small intestine start to be up this direction. You will see a portion of the large intestine as well. Moving down to the umbilical region, we're going to see the small intestine, and the hypogastric region, we see the small intestine and the large intestine, as well as the bladder. If you've got a female patient, you would see the uterus, as that tends to sit fairly midline if your patient has one. All right, so again, we've discussed this a little bit, but why do we need quadrants and regions? Again, a patient often comes in and they really just say that they have stomach pain. And the stomach is a particular organ to us as healthcare providers and not really a portion of the abdomen. A stomach is really just found sort of in that epigastric, maybe a little bit to that right hypochondriac region, just for the tail portion of it. But your patient's going to come in and say they have stomach pain. So what does that mean? Probably not stomach pain. It may be, but it may not be. What they're generally referring to is what we're going to call officially the abdomen. So they're having abdominal pain. You don't really need to correct the patient, right? I'm correcting you here because we're having a medical conversation and we're talking as professionals. But when you're talking to your patient, be aware that they don't really need to know this information. This is for you to know. What you do need to do is to accurately document one of those locations. So if your office is using quadrants to document, or if they're using regions to document, you need to accurately document a very particular location. You're just not going to say they have pain in the abdomen. You're going to say they have pain in the right lower quadrant, the left lumbar region. Okay, you're going to be particular as you're writing up documentation to your healthcare provider or to the doctor that you're working with. All right, where they are complaining of pain directly correlates to organs. And so it really helps a physician to narrow down the organs that we're talking about. If you've got pain in the upper left-hand side, we are certainly not going to do tests for the appendix, right? Is that to say that it never presents in a weird fashion? Of course not. But it really sort of helps us to narrow down the types of tests and images we're going to do for that patient moving forward to rule in or rule out their issue. All right, let's look at an example. So if patient comes in, they're complaining of stomach pain. Again, they're usually talking abdominal pain. One of your next follow-up questions really should be, point to where it hurts. Tell me specifically where it bugs you. And they're going to tell you, give a descriptor, point somewhere on their body. And that is what you are going to put inside of your medical notes, okay? So you're going to say, when I asked the patient to point where it hurts, they pointed to the upper right quadrant. They pointed to the epigastric region, okay? So whatever that is that you are putting in your notes should be very particular and medical.